Good morning.
Good morning.
I'm the proverbial egghead in the tower. I appreciate the opportunity to address you all. I'm not familiar with this organization until I met Sarah last summer and gave my input on the conference. I believe Clay was talking about me on the conference call when we needed a new dictionary. I had no idea what any of these terms meant, and I still don't. But I look forward to learning about that. So thank you for bearing with me with my thoughts. So I was asked to comment on the intersection of health and energy, and I'm going to do so from a research perspective, and very specifically my own type of research. I'm an epidemiologist, and for those of you who may not know what that is, it's not skin, and it's not insects. Skin rash, and then it bugs, but it isn't. It comes from the word epidemics. And what we do is we design and implement studies to quantify disease in populations. We look for patterns, and we look for risk factors or adverse health effects, or things that protect health. And we look for interventions that work to improve health. So as Sarah said, my particular area of interest is the indoor environment. And I'm interested in the indoor environment because we spend about 90% of our time indoors. We know that the indoor environment is unregulated to a great extent, unlike the outdoor environment. And there's just a lot that isn't known about the indoor environment. We learn tremendously about the importance of the indoor environment because of metals exposure, lead poisoning, but that's not the only thing. So pertinent to this discussion, the question is, are energy efficient buildings, building practices associated with occupant health? That's a question that needs to be answered. And if so, does it protect health or does it increase adverse health outcomes? My first observation in thinking about this was I'm a scientist. So I tell my students, I don't really care about your opinion. Like, I don't really care about what makes sense. As an egghead scientist, my job is to quantify things and look at things systematically, based on observations that make a whole lot of sense from a lot of really smart people. And my first observation in talking with people in this group and planning the conference and throughout my career, trying to move my research into the applied field and into public policy, is terminology. And the terminology in preparing my remarks today that was confusing was energy efficient housing, green housing, and healthy housing. These are not the same. And I think everyone will define them differently, but since I have the podium, I had to look on the internet at the Department of Energy site to find out what energy efficient housing was, what the definition is, which says something about the need for integration of the different fields, I think. Much more familiar with green housing and healthy housing. And it said that having the definition of energy efficient whole housing solutions includes site conditions, local climate, appliances, insulation and air sealing, light, heating and cooling, windows, doors, etc. And that the benefit of that is a healthier indoor environment. And then my ears perked up. And my first question is, what do they mean by a healthier indoor environment? That's the essential question that I think needs to be addressed. And the problem with where we are today and the opportunities and the challenges is defining what a healthier indoor environment is. And I think we can boil it down to two different things. Is it the level of contaminants in the home? Or is it the impact that the contaminants in the home has on health of its occupants? And they're not the same thing. They're two different things, and they're both important. How can energy efficient housing actually improve health? There's a lot of benefits, potential benefits. And I just listed 3 of them. One is the use of energy efficient appliances. Combustion byproducts are known to adversely impact respiratory health, cardiovascular health, and perhaps neurological health. So if we're able, through the use of energy efficient products, to reduce the combustion byproducts, there is a potential to improve health. Improving ventilation could reduce moisture. Moisture is associated with the proliferation of house termites, cockroach, fungi, all sorts of molds, which we know are associated with asthma. So it has the potential to reduce exposure to those contaminants and improve asthmatic conditions. It also can reduce airborne contaminants through circulation of the air. and as we said, chemical exposures and the like. A tighter envelope, sealing everything, reduces outdoor pollutants from entering the home. That's a real benefit. But therein lies the problem, in that in some of the early studies, there was concern that by sealing a home for energy efficiency, you are concentrating the chemicals and the pollutant concentration in the home. So there's a possibility that through doing that, you could actually harm health. Well, because of that, I think this is the way it goes. Green housing is slightly different than energy efficient housing in that it contains two additional components. One of them is the use of building materials that have a lower contaminant levels, primarily volatile organic compounds. And so this idea of sealing the home, you have lower levels of contaminants to begin with, and so improving health. And then the second one is the use of integrated pest management to control pest infestations. And that is a procedure that uses fewer pesticides in the home, which is a very important thing for improved health. So to me, that's the terminology. We have energy efficient housing, green housing, and then the question is this healthy housing or healthier housing? So what's the current state of things? Green building design is becoming broadly adopted, and I think that's a really good thing. The energy savings associated with this type of building have been thoroughly evaluated, it looks like, at least according to my Google search. But the health benefits of green building are only recently being investigated, and I think that's what I want to focus my remarks on. Again, it's a really important area of research, not just because we spend a lot of time indoors, but because we don't want to do one of two things. If green housing does not improve health, then we don't want in the public health world and the policy world to put a lot of effort into promoting that to improve health. It's not saying that energy efficiency alone is not a laudable goal, because of course it is. But for us in the public health world and people who are interested in improving health, we don't want to rely on this if it doesn't actually result in quantifiable benefits to the occupant. So the fact that we don't have a lot of research is important. There are scarce dollars. Now, if it proves to be healthy, data are needed, as you all know, to push a policy position. The reason that we could argue for the Clean Air Act, for example, is because we had very strong data, replicable data, that showed exposure to outdoor air pollution was associated with adverse health, mortality, cardiovascular disease, respiratory disease, etc. We need the same type of information on the indoor environment if we hope to regulate it, but only if it improves health. Otherwise, we'll go on to the next thing and fight like hell to get laws and policies passed. And also importantly, if these building practices don't improve health, yet harm health, that's really important for us to understand as well. So the current state of research knowledge is that we kind of lack data in this area. One of the reasons is because it's difficult to do research on the impact of building practices, healthy housing or green housing, and health of occupants. And I'm just going to touch on a few of those. First of all, there are studies that show that energy efficient green housing improves health, but the design is pretty weak. Why is the design weak? There are a number of things. First of all, many of the studies used as the endpoint the level of contaminant in the home. So you might be able to reduce exposure, but that doesn't say anything about health. And how could that be? It could be because the level of exposure in the home is not actually causing ill health. Imagine that. Or you were able to reduce exposure in the home, but you didn't reduce it enough to improve health. That requires knowledge of the association between the contaminant level and health, a threshold effect. And we don't have a threshold effect for the vast majority of the exposures that are in the home. We do for metals like lead poisoning, and even that is under fire. The scientific community has been arguing for quite a while about what those safe levels are. But there's a lot of data, but there's not so much data now. So if you pay attention to the scientific data, we're really looking at basic questions like are volatile organic compounds associated with adverse health effects, and if so, at what level? So that's a very important area of research that we need to continue working on. There's a lot of geographic variation in contaminants, in building practices, and in vulnerability of populations. So in our research, I've been running a multi-setting study on greenhousing and health outcomes in vulnerable children in the inner city. Part of our problem is that the definition of greenhousing differs depending upon where you go and who's building the home. And so it's a little difficult to conduct the research. There was a recent literature review that was published in 2018, this year, and it included 49 studies. And I got very excited. And I thought, well, I'm behind the times, because I've not read 49 studies. So I looked very carefully at this systematic review, and it actually validated what we're talking about right now, which is that there's generally a lack of data. Most of those studies were cross-sectional in design, which means I'm going to measure everything at one point in time. They didn't have longitudinal follow-up. They had pre-post designs. So what a pre-post design is, I'm going to give my health status, that I'm going to do a renovation, and then I'm going to measure you again. And the problem with that is bias. It's just like a drug study, you need a placebo, right, to blind the participant to what's happening. And one of the other main problems with most of the studies is that they had self-reported health outcomes. They weren't quantified. And so if you ask somebody, hey, is your health better? And they say, yes, it is. And that doesn't mean that's not rigorous science. So I have 3 minutes left, so I'm going to say 2 more challenges, and then I'm going to talk about my opportunities. So some of the challenges are that there are many, many contaminants of concern, and there's also a lack of knowledge about how best to measure them. So if I go into a house and I'm concerned about volatile organic compounds, or I'm concerned about mold exposure, how do I measure that? Do I measure it in an air sample? Do I measure it in a dust sample? Do I measure it over 1 day? Do I measure it every hour for 10 days? I probably need to go into the house and measure it over a year in order to get seasonal variations. That's a lot of time and money and a lot of attention, but it's needed. Am I concerned about acute health effects or chronic health effects? If you want chronic exposure or acute exposure, these are not the same thing. So when you look at the body of literature, and it looks like there's a lot of studies, all of these studies are very different. They're looking at different research questions, actually. So I want to end on opportunities. There's a lot of interest, as evidenced by this conference. I just can't believe the number of people in the room, and Sarah's remarks were so applicable to a conference that I might attend. That's a bunch of health scientists. I think it gets me very excited. Exposure scientists, epidemiologists, building experts, policy experts, philanthropic organizations. I will be hitting you up for funding. So happy I'm here. I have letters of support from everyone in the room and everybody else that I've missed. There's a lot of confusion among academics like me that are health professionals and call ourselves experts on the indoor environment, children's health, health disparity, on what is possible in building science and measurement. I really don't understand the building envelope. I need to be taught. There's a lot of confusion I find when I talk about energy in building sector colleagues about research needs. My favorite anecdote is my dear friend who works for Global Green. Several years ago, I came to her with a research project and I said, would you collaborate with me? She said, absolutely, this is exciting. I said, my primary research question is whether green housing is healthy housing. And she said, Felicia, it is. And I said, no, we don't know that it is. And she said, well, I've drunk the juice. And I said, well, I'm very glad you drunk the juice because the energy efficiency associated with green housing and healthy housing and the overall environmental benefits of lowering the contaminant level in a home is important, whether we as scientists can quantify it or not. So I think that the goal is very, very laudable. But I also think that we can push policy forward if we get our science a little bit stronger. And so I'll end on that note. I appreciate the opportunity to address you all.